Medical coding has been in existence for over 150 years. It takes the descriptions of diseases, illnesses, or injuries and procedures found in many kinds of written medical documentation and converts these descriptions into numeric or alphanumeric codes. Originally, coding was performed to classify mortality or cause of death information to keep statistical records. Today, both mortality and morbidity or non-fatal disease information is converted to diagnosis codes, and services provided for patients are converted to procedure codes. The codes are then used to submit information to insurance plans for payment purposes. The most important thing for a coder to remember is, if it is not written in the medical documentation, you cannot code it. Another way to say this is not documented, not done. The two questions a coder has to answer about every case are, what was done for the patient, or what services were provided? Why was the service provided? To code the what, coders use the CPT-4 or Current Procedural Terminology 4th edition book to record the service provided. You will learn more about CPT coding in a future class. To code the why, coders use the ICD9 CM or International Classification of Diseases 9th revision clinical modification book to record the diagnosis. The diagnosis is the medical reason for the service provided. The ICD9 book contains 3 volumes. Volume 1 contains the codes listed in numerical order. It is called the tabular list. Volume 2 contains the alphabetical index. In this class, you will use only Volumes 1 and 2. Volume 3 is used for coding hospital inpatient information only. ICD codes are used to submit insurance claims to assure providers receive appropriate reimbursement for each service provided, track diagnosis treated by providers, and to provide statistical data on illness and causes of death. The World Health Organization, called the WHO, is responsible for the ICD codes and the collection of statistical data on an international basis. In this country, the National Center for Health Statistics, called the NCHS, which is part of the Center for Disease Control, the CDC, is responsible for maintaining Volumes 1 and 2 of the ICD. The NCHS approves changes to the codes, descriptions, and guidelines used for diagnosis coding in the United States. New ICD books are published annually and placed into service October 1st each year. It is very important for you to make sure that you're using the most current version of the manual. There is a 10th revision of the ICD codes which will be implemented in the United States in the future. A good coder is someone who likes to read and is comfortable doing the research necessary to make sure they're using the information provided to select the most appropriate code for each situation. It is important for you to become comfortable with your code books. You should make notes in your book that will help you as you work. The notes should be recorded in the book itself. While you are allowed to add tabs to your code books, examinations for coding certifications such as the CPC exam do not allow you to add sticky notes or loose leaf pages to code books used during certification testing.